morning break and another Brain Matters segment brought to you by Gates of Brain Health, where we have Dr. Randall Gates, board-certified chiropractic neurologist and chiropractic physician, joining us once again. So thank you for being here.
Yeah, thanks for having me.
Let's talk about dizziness.
Okay.
What it is and what does a patient with dizziness kind of go through?
Oh, good question. So dizziness is an illusion where the person oftentimes feels like they're swaying or they may feel like they're floating. However, the definitions have changed recently. Vertigo used to be when someone would feel as though the room was spinning around them or they were spinning. However, the new classification is that if the person feels as though they're rocking and bobbing and they're moving, that can classify as vertigo as well.
So when it becomes something that is dangerous, there's a little bit of a difference between that versus you were out on the boat all day and now you're laying in bed and you're like, man, I still feel like I'm in a boat.
Exactly. Yeah, though this is not meant to diagnose anyone, talk to your doctor. Some of the cardinal signs of dangerous vertigo is when the person is having vomiting and they keep vomiting and they have horrible headaches, lots of times associated with it. That's when people, oftentimes really need to be seen at the ER.
Okay.
And relative to the dizziness patient, what's interesting is that they will go through a series of steps because everybody does something a little different. So for example, they may see their primary care doctor who then refers them to an ear, nose, and throat specialist who looks at their ear, may send them for ear testing. If that comes back kind of unequivocal or normal, they may be sent to a neurologist, and then they may be sent for a brain MRI. But as you and I were discussing before the show, that could take 9 months to work through all of that based on how far we're booked out here in Northern Nevada for certain referrals. Not everyone, but that is what I hear oftentimes.
Okay, that's really interesting. And that's kind of where we talk about Advanced Imaging Reno, where we can get them in a little bit faster. And that business that you are...
so basically I'm a proprietor. I'm a proprietor owner of Advanced Imaging Reno and Gates Brain Health. I always like to make that demarcation.
That's where you guys come in.
That's where we come in. So Advanced Imaging Reno, you can talk to your doctor about a referral to Advanced Imaging Reno. We're aiming to get people in quickly. We're trying to change kind of that climate. Also, as we discussed before the show, where when somebody has a sinus infection, they can go to urgent care. Their problem is fixed right away. Whereas those who have dizziness and vertigo and chronic neurological problems, it may be a construction worker who hurt their back on a job site, lots of times they have to wait and wait and wait to get answers. So we're really trying to change that and expedite their health care to get them the answers they need much quicker.
Right, because when you think about, let's say, that 9-month time period in which somebody starts feeling symptoms, they come in and see a doctor, to the 9 months when they finally get to like the last referral, so much could change in that time.
And lots of times then they're like, okay, my brain MRI is normal, and then what? And that's where then Gates Brain Health comes in, because that's where I see a lot of patients there with that type of description, because we work with chronic dizziness and vertigo patients every day. And then that also parlays into, for Advanced Imaging Reno, with whole body MRI. So as we talked about last time, I've been shocked at the number of diagnoses that have come up on whole body MRI and life-saving diagnoses often. And what we're finding is that it's not only that diagnosis, but now that person is getting a faster treatment to their problem that they didn't even know was there. So now we're moving quickly on these cases.
Yeah, because like the body, it is so fickle sometimes, right? It needs a little bit of one thing or a little less of something, and it can change its entire trajectory. But in the meantime, people are suffering.
They're suffering, and they don't have to suffer, and they don't have to be without answers. So if people want to go through those mainstream channels, I totally get it. The mainstream is wonderful. I'm never knocking the mainstream. These doctors are brilliant. They're really good at what they do. However, if we're looking to go faster, we've kind of created a route to go faster.
And again, this is specifically for people who are experiencing that chronic pain.
It's more that chronic.
If you're having acute pain, like you said, it's just like one little like weird week and stuff. That's when it's better.
If you have a sinus infection, that's different. But if even for those, we've had a number of referrals from orthopedic offices where we could get people in for knee MRIs right away.
Interesting.
Yeah, because again, this machine is brand new and it's faster. Just like this iPhone can do so much more than the first iPhone.
Yeah, that makes a lot of sense. All right, and of course, all of the information, both of Gates Brain Health and Advanced Imaging Reno, will all be on our website, kolotv.com. So if any of this is resonating with you and you want to give them a shot, definitely check them out. So thank you so much,
Thanks,
Dr.
Katie.
Gates. We appreciate it.
Right,
Thank you guys for watching. We'll be right back.